And now we're going, I'm going to show you another angle, yet another dimension, so that you get a better idea. And it would go like this. Now we're looking on the tooth from the top. And the tooth from the top looks more triangular. So it looks like more like this. And then you have a tooth like this. And it's probably more like this. And you have the neighboring tooth that is in contact here. And so on. But and here's the incisal edge. And then you have like little intricacies down here. So this is how an incisor looks from the top. If you look, and here's the palate somewhere. So now if you have fillings or you have a misaligned tooth, let's say this one is sticking out here too much, you will have to reduce more in this area. And I'm just going to point that out just by showing the reduction area. So if this is sticking out too much, you will have to reduce it here a little bit more. If you have a cavity here, you have to remove that cavity. If you have a filling here, you will have to remove that old filling. So once you design the porcelain veneer, and the enamel would be a little bit thinner here because you already reduced the enamel in this area a little bit, you would have to re-establish the thickness of the porcelain veneer. And so we go to here, and then we go like this. And it would wrap around like this. And it would be called a 3/4 veneer from the top. It is a 3/4 veneer because it really wraps around the tooth by about 3/4 of the circumference. And it gives you a lot of flexibility regarding reshaping a tooth. It removes all the weaknesses. The tooth in the future will be protected against decay, caries, because this is covered by porcelain. And the margins are in sound enamel. So if you bond those, they are in there. They will rarely come out. And there is another question that often occurs. What is the survival rate of veneers? How risky are they? Now, if you look at literature, 10, 15-year studies, retrospective studies, the prognosis of any veneer, if it's done well in a dental school, in a clinic, in a specialized clinic, is about anything between 92 and 98%. I personally have only experienced 3 or 4 failures among thousands of porcelain veneers, which gives it actually a percentage of 99-point-something%. So if they are done very carefully and designed very carefully, I have great optimism that they would stay in the patient's mouth for the rest of his or her life. Of course, you never know. They may bite in a stone in the salad, or other things happen. They will not be stronger than a natural tooth, and natural teeth break as well. However, they prevent caries from occurring in those areas, and they are less likely to chip than natural teeth if they're done correctly. If function is considered, and many other aspects that I don't want to get into right now. I'm just talking about the design of the veneers at this point. She came to the office basically stating, as many other patients, she wanted cosmetic dentistry, she wanted to look better, she wanted to look more youthful, and she was embarrassed about her smile. Now, this looks pretty dramatic, and the question is, how did it happen? And in her case, a whole different diagnostic process had to take place to figure out what were the causes of developing a jagged smile line like this. To keep it short, 2 major factors contributed to this appearance. One, she has a history of bulimia, where stomach acid has eroded the teeth from the inside and from the outside. Inside meaning the oral side, the tongue-oriented side, and then the outside-oriented side. So we have thinned out enamel, as you can see here. Here the enamel has been thinned off. You can see even the ridge. And this is the washed out enamel, and you have the same here. It's almost like some dentist prepared for a veneer. But this is what the stomach acid has done, and you can see it even here. And that should be enough. And you see also, you can look through here, it's like glass-like, and it's just a matter of one bite. to break those very thin edges off. The problem is we are not sharks, and those teeth don't grow back when we break them off like this. But sharks have teeth like this, and when they break it off, they just have other teeth coming back in. Human beings, it doesn't happen. So we had to do a lot of things with her, considering, and I'm not sure whether I mentioned it. So the second point was that she also has a dysfunction, a bite dysfunction, and she uses her muscles for the wrong purposes. She grinds her teeth and she clenches her teeth, which adds to the effect of the erosions of the prior bulimia condition that she had. So in her case, her gums didn't grow down significantly because this process had taken place pretty rapidly, not allowing the gums to actually grow down that fast. She had a slight collapsed bite distance here, or like vertical distance between the base of the upper jaw and the base of the lower jaw, which could be utilized to actually recreate the space that was missing here and rebuild new restorations with the proper relationship. If I just had rebuilt the restorations up to here without actually raising the vertical relationship, the teeth would have been sitting on the lower lip. So that wouldn't have been a solution. So all that had to be developed in many intermediate processes like diagnostic wax-ups, which at one point will be another presentation on YouTube, which are indispensable for complex cases of cosmetic dentistry such as this one. So just keep it short. This is the bottom line basically. And after several steps of treatment, she ended up with this situation. So the bite was slightly opened. We have a proper length of those teeth without impinging on the lip. The canines are riding on the lip. It also depends on the smile, how wide and how bright the smile is. There's polychromaticity. From here you can see more yellow areas and then transitioning into a more bluish grayish area here, which is basically caused by the translucency of the porcelain in this area. So we have the translucency here and we have translucency here. So here are the mamelons again. They're barely visible. I can see them directly here on the image. It may be more difficult to see on the video camera, but they're there. And then we again have the opening of those angles at the incisal edges. She also did get some gum surgery to even out and make it more symmetric. Here the zenith is on the same height as this zenith. The zenith here is slightly covered by the upper lip as much as here. And we see the same situation at the bicuspids. They are pretty symmetric. The same is true here on those central incisors. And even if the patient now continued the symptoms of bulimia and had acid passing these teeth are protected because they're covered with porcelain, which is not etchable with stomach acid.